Hi everyone, so welcome back. Today I am going to be talking about a common issue that I see in my practice, which is sciatica. The sciatic nerves, obviously you've got one on each side of the body. These are actually the largest nerves in the body. And connects the lower spine right down to the feet via the buttocks and the back of the thighs, and they control the muscles and sensation in the legs. And it's thought that the sciatic nerve is about the size of your index finger. So if you take that into account, that kind of explains why sciatica can be so painful. Now, sciatica, actually a lot of people think sciatica is a condition. It's not. Sciatica is actually a symptom of other issues going on in the body. So it's kind of often, as a massage therapist, it's not a case of treating the sciatica, but treating whatever the cause of the sciatica is. And so, yeah, it's basically a symptom of other issues, and it's caused really by irritation or compression of that sciatic nerve. Now, massage can alleviate sciatic nerve pain by a few different ways, by increasing endorphin release, which we've talked about in my other videos, and this can help ease pain and that burning sensation that is common in quite a few people with sciatica. It can also help by releasing tight muscles in the lower back, or the piriformis muscle, which I'm going to talk about, which sits just behind the glutes, which can press on the nerve, or actually sort of really compress it, again causing pain. So first, though, I'm going to talk about sort of what the causes of sciatica are and the symptoms, etc. So sciatica generally affects more so people over 35 years old. Quite often people whose occupation involves heavy lifting, maybe for long periods. But also those of you that have a sedentary lifestyle. So if you're sitting for long periods and there's a long period of physical inactivity, this can also bring on the symptoms. And also pregnancy. It can be quite common in pregnancy. And again, that's probably just due to the extra weight, that is just pressing on that nerve. So the most common causes are, we've got herniated lumbar disc, and I see this one quite a lot. Usually this one or the piriformis muscle are the two most common causes. So with a herniated lumbar disc, this is where the inner part of the disc that sits between the vertebrae leaks through the outer core, and this can then irritate the nerve. And I'd say that this is thought to affect or bring about sort of probably about 90% of cases of sciatica. So this really is the biggest issue. But also degenerative disc disease can also bring about sciatica, and this is where proteins from the weakened discs are exposed and again irritate the nerve. Also, it may involve bone spurs resulting from spinal degeneration, which again, compress on the nerve. But another thing that I see a lot in practice is where that nerve compression is caused by piriformis syndrome. And so this is where you have the sciatic nerve, if I can show you a diagram. So, okay, so you've got the hip here, and this is the thigh bone, and then you've got the spine coming down there onto the pelvic bone. So this yellow structure here is the sciatic nerve, and this passes underneath this piriformis muscle. And so where it passes underneath, if that piriformis muscle is tight, maybe due to overuse, or, you know, again, if you've got a sedentary lifestyle, what happens when that tightens, it's then going to pinch that sciatic nerve, hence causing the pain. And I do see this a lot. And so then that's where, as a massage therapist, you have to really work on relaxing that piriformis to take the pressure off the nerve. Now, there are some other causes of sciatica which are less common. So these are things like isthmic spondylolisthesis. Get a bit tongue-tied saying that. But this is where stress fractures can cause a vertebra to slip over another, which then again causes pinching of the sciatic nerve. Lumbar spinal stenosis, which is where the spinal cord, the spinal canal rather, becomes narrowed with age, and you get soft tissue overgrowth and bulging discs, which then compress the nerve. Sacroiliac joint dysfunction. So this is that sacroiliac joint, so that's sort of going into the pelvis, where the sacrum of the sort of lower spine meets on that, you know, pelvic bone. And so this can irritate the L5 nerve, which lies over that sacroiliac joint. Pregnancy, we sort of mentioned briefly. So the weight gain, changes in the centre of gravity will then impact on how much, you know, pressure is on that nerve. And also scar tissue. You know, scar tissue can compress the nerve root. I have done a video on how massage can also help with scar tissue, so that might be worth a watch. Muscle strain. You know, inflammation due to muscle strain may compress the nerve. So there, you know, we're not necessarily talking about the piriformis. The piriformis is the most common one, but potentially even around into the glutes, you know, could cause some issues. And then we've also got things like spinal tumour, you know, where if the tumour grows to a certain extent, it could compress the nerve. Infection, which can affect the nerve root. Fractures, you know, if you fracture a lumbar vertebra, or ankylosing spondylitis, which is where you get chronic spinal inflammation, which may cause sacroiliitis. That's inflammation around that sacroiliac joint. And again, that's something that I've sort of seen in practice as well. So, okay, so symptoms. What are the symptoms? Although sciatica itself is a symptom, but what are the symptoms of sciatica? So obviously the main one is pain. So if you look here, so you've got the piriformis up here in those buttocks, and then so the pain, you tend to get 3 main points of pain. So that's one will be up in that buttock area, sort of radiating into the lower back, and then it will follow the root of the nerve, and you can get pain sort of down here on the back of the thigh, or even in some cases right down into the foot. And this pain, it tends to be a sharp lower back pain, which, as we've just said, radiates down the back of the thigh, sometimes to the lower leg and even the foot. It's usually a constant one-sided pain in the rear of the leg, which is often worse when sitting. You may get hip pain with it. You may also then get a shooting pain when you stand up. But usually the pain will feel better when you're either lying down or walking. And that again is just slightly less, compression on that nerve. The pain will probably worsen with a change of position or any sudden movements. So, for example, if you sneeze or you cough, you may find that you suddenly feel pain. And there can be burning or tingling sensations in the leg, which again, you expect with any nerve compression. Weakness, numbness, difficulty moving the leg or even the foot can also occur. So in terms of treatments, you can do things at home, things like heat and ice packs, 20 minutes every 2 hours may ease the pain. Pain medication, anti-inflammatories, possibly muscle relaxants in the short term. Exercises such as walking and stretching, which I'm going to show you some stretching exercises that are sort of recommended for sciatica. In chronic cases where other treatment methods have failed, surgery potentially may be an option to remove a slipped disc or to widen the spinal cord to relieve the pressure. But this is in limited cases. In terms of preventing sciatica, really, you're looking again at exercise and stretching to try and prevent it. So I'm going to show you now some stretches that can be done, and these would work particularly well, if you did these alongside massage treatments. In my experience, clients sort of say that, that's sort of the best way they have of managing the sciatica. So I'm going to show you a few stretches here. You can actually start, we've got 3 versions of the pigeon pose from, if anyone has done some yoga, you'll recognise it. So you can start with the reclining pigeon pose and work up to the forward pigeon pose. But if the stretch at any point causes you pain, you should stop. So the first stretch that I'm going to show you is that reclining pigeon pose. And so this is this one. So this will really help to open up those hips and stretch that piriformis right into the buttocks there, which is the one that usually is responsible for, compressing that sciatic nerve. And so laying on your back, you're going to bring one leg bending at the knee, up, and then across, bringing the other leg up at a 90-degree angle. And you're going to place that first ankle or lower calf across that knee, and you're going to feel a stretch right down here where that piriformis muscle is. And you want to hold that for 10 to 30 seconds and maybe do this 3 times. Okay, and then when you're comfortable doing this one, you can then move on to the sitting pigeon pose. And so for this one, you're going to sit up with your legs stretched out, but you're going to bring the foot of the affected side across so that the ankle or lower calf goes across the other leg on the floor, just above the knee. And then you're going to bend forward, reach for the feet if you can, or as far down as you can go without pain. And again, you're going to feel that stretch on the affected side. So on this picture, it would be this woman's left side, the side where she's got the leg bent over. You're going to feel the piriformis stretch in the buttock on that side. Okay, and again, hold 10 to 30 seconds, repeat 3 times. Once you've done this stage, you can then go onto the forward pigeon pose, which is this one. So on this one, you're going to, again, with the affected side, bring that leg forward and then bend, flexing at the knee. And then the unaffected side, the leg is going to be straight out behind you. And then you're going to put your hands in front of that front leg and just lean forward while pushing the hips down towards the ground. And again, it's going to be on that affected side. So in this picture, it's going to be this woman's right side where she's going to feel that stretch in the piriformis. And you will also find if the piriformis is tight, which it's going to be if you have sciatica, you will know it's tight, not only from the sciatica symptoms, but when you do this stretch, that knee will be particularly flexed and the foot will be in by the groin because you won't be able to bring it out. But as the piriformis muscle loosens off, you will find that you will be able to bring this leg out more sort of at a 90-degree angle. So it's more in line with the shoulders. And by bringing it into this position, you will get an even better stretch on that piriformis. And it will also be a good indicator, the position of this front leg will be a good indicator of how tight that piriformis is. And obviously even once the sciatica symptoms you've noticed maybe have gone, it's still a good idea to do that stretch on a daily basis, if you're prone to sciatica. And hopefully, if you can maintain that front leg sort of in line with the shoulders, that means that piriformis will then be relaxed enough that it's not going to cause compression on the sciatic nerve again. So that's quite a good preventive stretch to do. Now another good one is lying on your back and bringing the knee of that affected leg, again bringing that knee up towards the opposite shoulder. So the left leg, if that's the affected leg, you'll be bringing the knee across the body towards the right shoulder. Or if it's the right leg that's affected, you'll bring it towards the left shoulder. And again, just hold it for a count of 10 to 30, repeat 3 times. Then we have a sitting spinal stretch. So this is going to be quite good for, if your sciatica is caused by, problems in the lower back. So again, sitting, legs straight out in front, bring the affected on the affected side, bring that leg flexing at the knee, and then bring the foot up to be sort of level with the knee on the good side, the leg of the good side. And then you're going to bring, supporting with one hand behind you, you're going to then bring the arm from the unaffected side across that knee that you've lifted up, and you're going to twist away from the body to look behind you, and you're going to twist towards that affected side. And that will not only stretch around the spine, you will also feel a little bit of a stretch, probably down, in the glutes as well. And then the last one that I'm going to show you, and this is particularly good if you get pain sort of right down into your legs. So this would be the standing hamstring stretch, where you just basically standing, rest your foot on a chair or whatever it may be, leg out straight on the affected side, and just lean over as far as you can, keeping that leg straight. And this will just help relax those hamstrings on the back of the thigh, and stop them from, because obviously if they're tight, they could further cause some compression on that nerve as it runs down the back of the thigh. So between those stretches, you can cover sort of tight hamstrings, you can cover the piriformis, which is obviously a common cause of sciatica, and also it addresses through that seated sort of twisted stretch, it addresses also the lower back. So you're kind of going to hit it from all angles. But as I say, doing these stretches combined with massage therapy can be really successful in managing sciatica symptoms, and also helping to prevent it from sort of coming back. And yeah, certainly I've had a lot of clients, and they'll come, even just once every 4 weeks, maybe for a deep tissue or a sports massage, and they find that really, helps keep the sciatica at bay. So that's all from me on sciatica. Feel free to subscribe to my channel for more videos, or comment down below. You can also ask me anything, through my Facebook or Instagram, and I'll do my best to answer you. But for now, that is it from me. So good luck with the stretches. Take care, and I will see you next time. Bye.